What's up, everybody? How are we doing this evening? I see a few of you are already here. Welcome in, welcome in. Thank you uh, for hanging out. Welcome to the Performance Medicine Show. Roel, I see you, man. D. Lynn, Robert, thank you so much for that kind comment. Thank you for watching the episode with Dr. Bolton there. I'm actually going to talk a little bit about that here in a minute. We've been passing along that link in office, actually. Had such a amazing impact on so many different people. So thank you, Dr. Bolton, if you're watching. Thank you. I think we're in the process of trying to get him back on the show. So I'm looking forward to that. Terry, what's going on? Susan, hello. Bianca, Amber, great to see you. It's been a couple hours since I've seen you. Hope everything went well in the office. I know I wasn't there the first part of it. Mark, what's going on? Grandma Mary, what's going on? Thank you, Mark, for the background. We're kind of tinkering. I feel like Dad's set is like just a little cooler than mine at his house. Chrissy, what's going on? Great to see you. Thank you guys for hanging out with us tonight. We are stoked to be here. I'm trying to get my mic all good. Scoot over just a tad, so I'm not going to be super in the middle here. All right, as Dad gets ready, Lisa, what's up? Thank you for sharing. Great to see everybody in here. And speaking of Dr. Bolton here, I'm just going to put this up for the people who did not see this in the email that went out today. This is an outside the box episode from about a year ago. My cancer story with Dr. Dan Bolton. Got diagnosed with throat cancer in 2019. And he talks about just the way he took control. And I think that's the big message here, is he and his wife took control of their own health. And his story is just amazing. You guys need to watch that. I know our providers have been passing along that link to patients inside the office. So definitely check that out. Robin Riddle, the star of Explain This, and also our nurse practitioner in the Knoxville practice, did an episode on cortisol. And if you guys have heard us talk about cortisol, I'm sure you've heard of cortisol. We do the cortisol curve in office, and we talk a lot about adrenal fatigue. This episode is about how cortisol works, how it works for you, and how to prevent things like adrenal fatigue. Talks a little bit about the testing as well. So if you're interested, if you feel like, when you sit down on the couch, you just can't get back up, check out this episode. It's a really, really detailed one. And Robin talks about cortisol in a way that we haven't. So definitely check that out. Shout out to Robin Riddle. Let's get this one up here from Doc. The Common Sense MD episode was on apigenin and inositol. These two supplements, Dr. Huberman has been talking a lot about these in regards to his sleep stack on his podcast, the Huberman Lab. Dr. Rogers in this episode kind of details the way he's added them into his regimen. And these are two supplements that we haven't talked a lot about in the past, and they're not super well known. So be sure to check that out if you haven't already. And then I'm going to put this up here for all of, actually this is happening in Johnson City, Kingsport, and Fountain City. Lips, Hips, and Sips is happening February 2nd, February 8th, and February 9th. The 2nd in Kingsport, the 8th in Johnson City, and the 9th in Fountain City. As you can see there's some specials going on. And, it's all a little distinct based on the location you're going to. So we'll be putting this up a few different times between now and the 2nd. Shout out to those offices and to the aesthetics team for putting that on. We're super excited about that. Jack, I see you. Carter, what's going on? Great to see you. Let's see, Deborah, Rita, hello, Allison. Thank you for watching. Let's bring Doc in. Doc's ready to roll? All right, he is. What's going on, man?
Hey, man. How are you?
How are you? We actually haven't I haven't seen you since last week
I
when we did
know.
when
I
we
know.
did this show. So let's do just a quick
Do you like
check
this thing
in.
I'm growing here on the beard? You can't see it, can you?
Well, it's too gray.
I know. That's the problem. That's the problem.
Guys, I had to throw in a
Thank you, man.
little
Thank you, man.
zinger to get the show going. No, are you growing a mustache or is it a
No,
beard?
it's kind of one of these, just a partial beard. Just because I burned all that stuff off my face, with the 5FU.
Yeah.
So it's kind of hard to shave when you're doing that. So I just left a little bit.
You know the scar. I can't.
It'll be gone in a week.
No, I dig it. I dig it. You got that look of like sophisticated, but I'm also kind of chill at the same
Yeah.
time.
I'm getting into studying all these intellectual guys. Matter of fact, I want to read you a quote that I had a patient that came in today that gave me this quote, and I liked it so much I told her that I was going to put it on tonight's little Q&A session. Remember the psychiatrist Carl Jung?
I
It's
do.
actually
Yeah.
with a J, though. He's a famous Swiss
Yeah.
psychiatrist who's kind of the father of modern day psychiatry. But he had this quote I like that she brought into me. And it says, your vision will become clear only when you look into your heart. Who looks outside dreams. Who looks inside awakens. Carl Jung.
Interesting. So that's more. It's kind of like an
Yeah,
introspection.
kind of. Yeah, I kind of like that quote, really.
I dig that.
I'm studying all these guys like Da Vinci, and I'm looking at some of his stuff. And some of these older guys are really smart. We can learn a lot from them.
Yeah, I've also heard the quote that like it's it's better to like reread the best 10 books of all time versus like try and read as many books as possible. So like if you find a book that you really really connect with, it's as beneficial or more beneficial to just you know dive deep into it, reread it,
Yeah, that's a
go
good
over it
thought.
with a fine-tooth comb.
I know.
um,
I had so many good patients today that a lot of new patients and a lot of them that I really enjoyed because I think I can help them. They're just searching for an answer as to why they're overweight or, have like these autoimmune issues or gut problems. And it's just really interesting to meet them and try to set them in a direction of better health because a lot of them just don't know what's possible. And that's what kind of excites me about medicine and all the new things and the new thoughts. And unless you're continually studying and observing, and are curious about the human condition, then, you're not doing yourself or your patients justice, I don't think. It's just a new way of looking. I think I put 3 or 4 people today on the carnivore diet. They're asking about, I did a podcast on one, and I can almost guarantee that they will do better. They'll get leaner. Their autoimmune issues will get better, and they'll have more energy, and their gut will be better too. The autoimmune diet, to me, the best autoimmune diet's a carnivore diet.
mm.
Um, when I was having those gut problems, that really helped me, along with Robin's expertise and the GI map, that really helped me a whole lot. So it's kind of different for, when I'm sitting there telling some patients not to eat vegetables. And I tell a lot of patients, don't eat vegetables. And I go, I bet you've never heard a doctor say that before, have you? And they're kind of shocked. But then when they come back after being on the carnivore diet, they just feel so much better. And a lot of times it just turns them around completely. It's really interesting, though. I tell them,
Yeah,
they say, why? And I go, well, for one thing, plants don't like to be eaten. That's
it
why,
makes total sense.
yeah. Matter manufacture all this toxic stuff to our bodies. And anybody with IBS, the way I diagnose IBS, irritable bowel syndrome, is say, what happens when you eat a salad? They say, I can't eat salads. It tears my gut up. Well, you have IBS, which is just it's a name for something where we don't know exactly what it is. Although we know really it's a dysfunction of your gut microbiome. So, you got to kind of think outside the box a little bit. But that's what, like Dan Bolton, you're mentioning Dan, he's just a fascinating guy to listen to and to know. He's a really smart guy, and he looked outside the box, and along with the traditional cancer treatment, he sought out some alternative stuff and really did well, doing great. But I went and re-listened to that podcast this past week, and I really enjoyed it.
It's a really inspiring story. And, I think it really embodies this idea of taking control of your health. And just with what you're saying with the patients you saw today for the first time, like, it's amazing how, when people realize that there are solutions that, if you're feeling tired, or if you're in pain, like that, there are things you can do. And I love what you said about the gut with the carnivore diet. Even just the idea of like trying something like that, I think is really encouraging. And I think that's a lot of what people get in the office with you, and what we hope to give to people who are with us live on this show. Different solutions that people can try that might be a little outside the box or outside of the traditional medical perspective.
I saw a new patient today, for example, that had Crohn's disease, and through the years, and he'd actually had 2 major surgeries to remove different parts of his colon. And he was on all kinds of things, all kinds of biologics and all kinds of medicines, and still having a rough time with it. And because he'd become tolerant to a lot of the heavy duty medications that he was on, including a lot of IV infusions and things of biologics. And I asked him if his GI doctor had ever talked to him about what he ate, and he said no. And it's just, I couldn't believe it. It happens time and time again. I'm just dumbfounded when I hear that. But anyway, so we're going to, as a matter of fact, I put him on the carnivore. That's one of the ones I put on the carnivore diet. I can't wait to see how he responds, because he has some other issues as well. And I think it'll help him. We'll see.
I absolutely believe it. We've been talking a little bit with our nutrition coach, Lucas Schmidt, about he did an experiment on the carnivore, and he was eating a ton on it and still lost weight. And I think he went modified was what he did. But it seems to help a ton of people. We got some questions, guys. All right. For the people who are new, we take questions at the beginning of the show from people who either submitted them through email or on one of our social channels. And then the latter part of the show, the second half, we take live questions. So if you have a question for Dr. Rogers, go ahead and put that in the comments, and we'll get to that here in a few minutes. So go ahead and start putting the question in. We're going to start with questions that came in throughout the week. This is actually one that I missed last week, and really apologize. I hate it when I do this. So I'm going to get this question in first. If I can find it. It looks like I've already missed it again. Oh, here we go. Question is, I know this may be more of a heart surgeon question, but can anything be done to help folks that are recovering from strokes, like regaining their ability to speak, walk, or use limbs? So this is a stroke question. What's your thoughts on kind of recovery here?
Certainly all kinds of stuff you can do. But of course, the first thing you think about is physical therapy, occupational therapy. A lot of times you'll have to learn how to swallow again, how to talk, how to move. So a lot of it depends on, where your stroke was located in your brain. and what caused it, whether it was hypertension or whether it was a bleed. Um, Usually they're more ischemic strokes, meaning the blood supply is cut off, not from a bleed. But anyway, yeah, I mean, physical therapy works wonders. You know, I was reminded today about a case. My niece was involved in a bad motor vehicle accident a few years ago while she was in college, and very serious head injury. Ended up spending several months in rehab down at in Atlanta at the world's most famous recovery center for head trauma, and it's called the Shepherd Center. And anyway, my brother, her dad, was talking to the nurse one day, and he's also a doctor, and he says, "Why, why are most people here? Is it through accidents? Is it, strokes or what?" And she goes, "Ladders." And he goes, "What do you mean ladders?" He goes, "Most of the people in here have fallen off ladders." I had a patient today. The reason I remember this is because one of my patients today had fallen off a ladder and punctured their lung, had a 4-foot ladder, had to get a
Oh,
chest tube.
no kidding.
4-foot ladder, had to have a chest tube because of fractured ribs and pneumothorax. So be careful with ladders. But yeah, I mean,
Wow.
certainly I'm getting off the subject, but yeah, I mean, you have to do physical therapy, and it may take a while. You have to be really patient for this thing. So, that's a great question. You got to use everything you can do in rehab to relearn everything from how to walk to how to talk to how to swallow. But those are the real heroes, the people
Mm.
that have the patience to bring you through a rehabilitation like that. Hope that answers your question.
Great question there. Thank you for putting that in. Again, I apologize that took me a week to get to. Another question is, any suggestions for curing gum diseases besides the normal brushing, flossing, etc.?
One thing I wouldn't do is use mouthwash. I don't think mouthwash is good for anybody. It just destroys all your good bacteria. Life Extension makes a pretty good oral probiotic that's good for gum health. It's good for your throat as well. Again, you need to brush with the right kind of toothpaste. I found that I use different ones, and ones that don't have the bad stuff in it, like fluoride or SLS or some of that stuff. I use one from Burt's Bees that really helps me a lot. And I have real sensitive gums and mouth in general. That's one reason I take L-lysine, which I think will help you. Make sure you're taking a probiotic, because remember, the first part of your digestive system is your mouth. So take care of your mouth. One thing I like to do in the morning, one of the first things I do is get some coconut oil, and I do something called pulling. So I get a teaspoon of coconut oil. It's hard, and organic coconut oil. And I put it in my mouth, and I kind of pull it through my teeth and gums for a few minutes. I think that's really healing and really healthy for your mouth. And then avoid foods that irritate, that are inflammatory, like sugar, glutens, dairy. So I like the coconut oil pulling through your teeth. Certainly flossing, gentle flossing, making sure you see your dentist. There's even a question of some people like to get their metal fillings out.
Yeah.
Because I think sometimes that irritates gums. I'm not a big fan of fluoride either anymore. You can do your deep dive on that. It's really kind of toxic. But don't use mouthwash like Listerine and Scope. Just leave them out. They're bad for your mouth and your GI tract. And take a probiotic.
All right, great gum disease question there. Let's go up here. This is
If your gums aren't healthy, your heart's not going to be healthy. The bacteria from your gums can seed right to your heart. So, interesting.
All right, let's get to this is a question around acne. I have a 13-year-old son with acne on face, back, and shoulders. OTC does not seem to help much. I'm worried he will start scarring. I just bought a proactive kit to try, but I'm not very optimistic. Let's see here. His PCP suggested antibiotics. I'm concerned with the idea of taking antibiotics long-term or without being necessary for sickness. So the question is around Accutane and whether or not that's something you suggest. Accutane from a dermatologist worked really great for their son, but can also have side effects. What's your thoughts on this?
Yeah, if it's just mild acne, you can try the retinol formulas like you just ordered. If it gets worse, then certainly I'm not against using doxycycline. For one thing about doxycycline, it's one antibiotic that does a lot of different things. I use it for a ton of different reasons, even sometimes treating things like rheumatoid arthritis. I'll put them on a month of doxy, and most of the time they get better. It's got some great anti-inflammatory effects and seems to, it's pretty resistant to building up a tolerance with doxycycline. Certainly after age 12, you can use it. You don't want to use it as a young child because it can stain your teeth yellow. But so I'm not against that if it gets worse. And then the next step, of course, is Accutane. So if you have cystic acne, and you're worried about scarring, I'm okay with Accutane. It's a heavy hitter, very expensive, unless your insurance covers it. It's really vitamin A. It's a form of oral vitamin A. But it does have some side effects, at least it's your son and not your daughter, because they have to do pregnancy tests on females monthly. And they also check lipid panels. It can really pop up your triglycerides. It'll really dry you out like a chip, but it really does work. So I think you got to weigh the benefits versus the risk. So it's really very severe cystic acne. You want to get that early before it starts causing a lot of scarring for sure. So I'm not against it. Try the other stuff first. If you get the feeling that's not working, I would put on Accutane over nothing. I mean, the mental effects of that can be harsh. So yeah, I'm not against it. Watch out for the side effects. Do your routine blood work, and get out your pocketbook if the insurance won't cover it.
And this is kind of along the same lines with skin and kids. I have a daughter who suffers from eczema. I prefer natural solutions, but I'm open to other options that are felt to be overall safe. If performance medicine has opinions on these skin issues, I'd love to hear them. What's your thoughts on this?
Yeah, relating to both those questions, first of all, too, you look at what you eat. Don't eat sugar. I mean, sugar makes acne worse. It makes eczema worse. Look at your diet. The first thing you look at with any of those kind of skin rashes is your gut. Look at what you're feeding it. If you're feeding it sugar or glutens or dairy and your gut's not working right, then, just sometimes eliminating those bad foods and getting on a probiotic like Digestia will help. But eczema, you can get on some pretty heavy hitters for that as well. Not Accutane, but biologics. There's Scleritis. There's all kinds of new ones you're going to see on TV all the time because they're high dollar, money making medications, and they do work pretty well for some people. But again, it's a heavy hitter, and young person, you're not exactly sure what that's going to do to their immune system later on down the line. So if you can avoid the biologics, I will. Of course, start out with the steroid creams and things like that. drink a lot of water, watch your diet. I'm even okay on going in, for if it's worse during the winter to, get in a suntan bed if you need. Just don't get burned. Remember, the sun's good for you. Just sunburns are bad for you. So I'm not against that for that condition. Depends on how extensive it is. Psoriasis is usually worse than eczema, but they're both autoimmune disorders. Sometimes low dose naltrexone may help. You can look that up and do your research on low dose naltrexone. It's really helpful for autoimmune diseases. Eczema and psoriasis are kind of, psoriasis is on the extensor surfaces. The eczema is more on the antecubital spaces and the flexor surfaces, the insides of joints. But they're both autoimmune diseases. Anxiety can flare them. Certainly hormones can flare them. But really interesting. So you have to take a multifactorial approach to it. First thing I start out with is diet. And certainly take a probiotic as well. Hydrate, avoid sugars. It's hard to tell you to avoid stress, but and again, I like L-lysine as a supplement for your immune system.
All right, let's move on to let's get a hormone question in here. Changing from a BHRT cream to a troche in hopes of better absorption. I forgot to ask this. Clearly, it doesn't go through the digestion like an oral estrogen, which I know you are against. The question is, but couldn't trace amounts be swallowed and thus digested with your saliva as it dissolves under your tongue? Is this not a concern? And if you need me to go back.
No, it is a concern. That's why I don't use them much. Hardly ever use troches, just because of that reason. A lot of it's oral. You're swallowing some of it. So I'm not big on them. I like the creams and the pellets. I really just prefer them. I hardly ever use troches. Some people do. Some people use oral. It's certainly better than nothing, but when you do it orally, it can affect your clotting factors. It has to be metabolized through your liver. Again, sublingual, you get nearly as much as you would by swallowing it, and it's certainly more bioavailable than when you swallow it and digest it. So it's better than a pill, but you're right. You're exactly right. That's why I don't use them much. When I go to all the conferences, not many of the people that teach these things do either. So good point.
Great question there. And this is, let's see, it came in the same email. What are your thoughts on this man-do workout? And I sent this to you in an email. Since you mentioned your new physique machine, it made me wonder how this would compare. And the question is, would this workout, since it uses EMS, be safe for someone who has had issues with extreme PVCs in the past?
I haven't looked at that email, so I don't know. I've never heard of that workout, but if it uses EMS, which the physique that we have uses that, plus it uses a laser fat burner.
Okay.
So at the same time, so it's hitting both the fat and stimulating the muscle. But it's like you can get a workout without actually working out. If you have injuries or, it's pretty darn effective. It really is. I love the physique machine, but, I doubt it would bother you. One thing with that, I don't recommend that you put the EMS, especially in this case, on the chest. Don't use it for pecs. It wouldn't be safe. I only use it on abs, glutes, biceps, triceps, quads, hamstring. I don't use it on anything in the thorax. So it could, just avoid it around the heart area, heart and lung area. But in the other areas, I don't think it's going to precipitate PVCs. I'd be shocked if it does. Quit doing it. But I just haven't seen this with where you're supposed to use these things. Just don't use it on your pecs for sure.
Okay. What is a PVC?
Premature ventricular contraction. It's a skipped heartbeat.
Okay.
They're very common. They're usually very benign. But in some people, they're bothersome if you have a ton of them. Again, cut out caffeine, reduce stress. But PVCs are usually pretty benign.
Mm.
But some people notice them a lot and they get scared about them and stuff.
All right, let's get to a grounding question. We talked a little bit about earthing, the book Earthing, and which is around grounding last week. Question is, I've been doing some research on earthing and grounding. Has Dr. Rogers been able to see a difference in how his body feels since he has been using his mattress pad? It goes on to say, I've ordered the pad and pillowcases, but still waiting on them to arrive. I'm excited to get started, but curious as to how his body and mind have felt different since he began grounding. This is a good question. I'm interested.
Great question. Yeah, I can honestly tell you, I think it's helping me. You know, it's not earth shattering. It certainly wasn't overnight, but I really think I'm less stiff in the morning. As far as the mental aspect of it, I don't know yet. But certainly I like having it. You know, if you read the book Earthing, and I'm going to do a podcast on that really soon and go through the benefits of grounding or earthing, same thing. I think they're amazing. So I definitely feel less stiff. Last night I didn't sleep too well because when I woke up, my dog Ike, who usually comes on the show, was sleeping right behind my head. And he's a big dog. He's never been even jumped up on the bed before, but I woke up and he was right. I was like using him for a pillow and I had no idea he was even there. So
really, he jumped in the bed?
Yeah, I think he wanted to become grounded. I think he's been listening to some of my podcast and maybe he wanted to get grounded because he was laying right on my grounding pillowcase, right underneath my head.
I wonder if there was some sort of like natural instinct that he had around like the grounding or earthing pillow.
I doubt it very seriously, but yeah, I'm really big on grounding. I'm certainly going to use more moccasins and walk on the dirt when it gets better weather for sure. But it makes total sense. You should read the book. It's kind of convincing. You know, we're electrical. Human beings are electrical. We just are. Your PVC is an electrical abnormality. Your brain with all the neurotransmission, that's electrical activity. Your mitochondria put out energy via the electron transport chain. I mean, I was talking to the patient today and we were talking about that and all that stuff that I learned in college in physics and chemistry that I just memorized and didn't give a hoot about atoms and electrons and neutrons, protons and all. That stuff it's really useful, Wish I'd taken more interest back then as I do now.
I hope one of your chemistry professors is watching the show, so they can say, "I told you so."
I don't think they'd be alive, but they probably wouldn't remember me either.
All right, let's get to a couple more questions, guys. Again, this is the Performance Medicine Show. We're taking live questions this evening. We do this every single Tuesday at 7. So if you have a question for Dr. Rogers, go ahead and put that in the comments. We're going to get to every single one. This question is around Pristiq. Is it possible to get off of Pristiq without debilitating side effects? I've tried repeatedly for years and can't function long enough to get off. Goes on to say, I went on them 12 years ago and don't need them anymore, but I can't get past the withdrawals to get them off, to get off of them. What's your thoughts?
Pristiq is an antidepressant that affects both the serotonin and norepinephrine pathways. So it's dual function. And those seem to be harder to get off than just the SSRIs. Even the SSRIs can be hard to get off, especially some of them. They really are. But this one in particular, that and Cymbalta seem to be really hard to get off. You can get off of them. You just have to go really slow. I mean, it may take you a year to get off of them. Just get on a tapering schedule. And you might even, in the meantime, get on something else like a supplement like saffron. in the meantime, just to see if that would help you a little bit. That's maybe even consider low dose naltrexone. You're probably going to have to get on something else more natural to get off the heavy hitter like Pristiq.
So take them at the same time?
Yeah, while
Okay.
you withdraw, yeah.
Okay.
But it may take you a year to get off that.
Okay.
Unfortunately, but you can do it. There's no doubt you can do it. Sometimes you feel worse before you feel better, though. Just realize that.
Thank you for that question that came in on Instagram. All right, last question here, then we're going to get to the comments here. Could an unknown cancer cause high levels of DHT for a male, or would that be unrelated?
It'd be unusual. Testosterone usually can break down in one of two ways. One, it can go to estradiol. The other, it can go to DHT, dihydrotestosterone, which actually is a more potent form of testosterone. And I have seen that in a female. Well, it actually wasn't a cancer, but it was a tumor. It was a Leydig cell tumor of her ovary that was causing her to have really high testosterone and high DHT levels because of that. DHT, when you have too much DHT, it causes hair loss and prostate enlargement. So, I'm trying to think of any reason that you would get an androgenic tumor. It'd be really rare to have an adrenal tumor. When I found this other, I couldn't figure out why her T level was so high, being off. She was never on any testosterone at all. As a matter of fact, I saw a lady today. I'm working up for a high testosterone level that's not on any form of hormone replacement. So it'd be really rare. But if it depends on how high it was, it may trigger me to want to, do a more thorough check and maybe get a CAT scan of your adrenal glands if you're a male. And certainly I do a once over and, do a physical on you and make sure, check your prostate and check all this other stuff. But, certainly prostate cancer shouldn't cause a high DHT level. Certainly DHT can cause an enlarged prostate, no doubt about that. But that was the cause of it, not the result of it. So rare, but see what it is and just make sure nothing else is going on. You always have to look into other things. If you're a smoker, you need a lung scan. You need your colon looked at anyway. So you might want to look into it a little further, but I haven't personally found anything like that. It's not to say it couldn't occur, but it'd just be interesting to see how high it was and what the levels of the other hormones would be and do some screening test. But very good question.
All right. Thank you for that question that came on through email. All right, guys, we're going to take it to the comments here. We're going to try to get to as many as we can here over the next 20 minutes or so. Let's see if, where am I here? Looking for a question. Lauren, hello. Great to see you. I'm going to get to your question first. I've been stressed and not eating as I should. I'm suddenly dealing with a lot of bruises. What can I take to help prevent this during my time of appetite loss? So it seems bruising along with stress and maybe not eating as well as we'd like to.
You need to check your blood count. Make sure your platelets aren't low. And I assume from looking at that, you may be losing weight. And we say not eating, I'm assuming you're not eating enough.
Oh, yeah.
And then because you're having the appetite loss because of stress. I'm like you, when I'm stressed, I lose my appetite. Some people gain, more people gain their appetite and gain weight. But But you got to look into the eating disorders. Why are you stressed? What can you do about the stress? But the bruising, I mean, you can get, gosh, with bulimia and anorexia, if you're dealing with those, you need to see somebody for that sooner than later. Get some baseline blood work. You can certainly throw your electrolytes off, and you could potentially, throw yourself into an autoimmune condition and stress your platelets out and start bruising. So that you really need to look into that and see somebody like we do. I mean, we have a psychologist on our staff. We have a nutritionist on our staff, and certainly we do extensive blood work and can check that out too. But please see somebody that knows what they're doing sooner than later. Yeah, could definitely, you could be throwing some things off. I don't know if you've had blood loss. Certainly, stress can throw your menstrual cycles off, throw your hormones off. So please get a workup.
All right, Lauren, thank you for putting that in there, and we'll follow up with you. Let's go to Mark's question. What are your thoughts on Camels milk therapy for autoimmune issues? It may offer help for diabetes, allergies, autoimmune disease, and even autism. Have you heard of Camels milk therapy?
Yeah. Yeah, I have. Mark, I hope you're doing well. Good talking to you. Yeah, I mean, it's the most expensive milk on the face of the earth for sure, but a lot of people go to extreme lengths to get it. I've been reading about it for several years, and it does seem to have some healing properties, especially for autoimmune diseases. So yeah, I'm all for it. If you can get it, you can order it. There's one company that gets it, and they're based here in the U.S. I forget the name of it, but I'm sure you can find it really easily. But yeah, there's a lot of things that Camel's milk will do if you can get a hold of it. Apparently, it doesn't taste that bad either. Matter of fact, I had a taste of it at one of my conferences one time. Yeah, I thought it tasted all right. They were promoting it.
Interesting.
Yeah.
All right. Thank you for putting that in there, Mark. It's funny. I've not heard of Camel's milk. Okay. My brother, Steve, hope you're well, man. Great to see you in here this evening. I've had high cholesterol for years. I tried a statin, but it hurts my muscles. Do you recommend trying a different type? I'm hoping to control or even reduce my plaque levels.
Yeah, we deal with this a lot. Certainly any statin can cause muscle aches, liver damage, pop your sugars up a little bit. Some people will not ache with one statin and ache with another. I seem to have the most trouble with my patients that are on Lipitor. The one if I had to take a statin, and again, I wouldn't take one unless it looked pretty bleak. In other words, if I had a real high calcium scoring and had previous known heart disease, like I had a stent or a bypass, then I probably would take a statin, not because it reduces your cholesterol, because it does have some anti-inflammatory and perhaps plaque regression characteristics. But, so if I was to have to take one, I'd probably take a really low dose Crestor, rosuvastatin. You can try that if you want, but you can always try a non-statin cholesterol like Zetia, fenofibrate. There's some others that aren't statins that can help some, by limiting the absorption of the cholesterol. So yeah, there's a lot of ways around that. If you want to go completely natural herbal, I like garlic tablets for that, for sure. And, and also see what your corneal calcium scoring is. And if you've got plaquing going on, then another thing I use on a lot of people, I put a guy on it today, is EDTA, which is a chelator, which means binding, clawing. There's a lot of evidence that it can cause plaque regression. That's why so many people are lined up to get IV chelation, which is illegal in Tennessee, but in other states you can get it. But really, the oral I take EDTA. It's completely safe. It's even in baby food. But there's a lot of evidence that it can help plaque regression. So, again, I hope you've probably had the Cleveland heart panel that shows us the size of the particles, how inflamed they are. That ApoB number is the most important number on there. Really, a total cholesterol means practically nothing. The ApoB, if you look at all the tests, that's probably the one that means the most. And that number is a representative of not only LDL, but the particle size of the other low-density lipoproteins like VLDL. It can be a function of triglycerides. So, if you get the Cleveland, we can really look at how oxidized your LDL is, which is the bad cholesterol. HDL is known as the good cholesterol. But again, just a total and an HDL and LDL doesn't tell you much at all. You have to look a lot deeper than that. You need to look at your LP little a, particle size, amount of oxidation of your LDL, all your inflammatory markers like HSCRP and myeloperoxidase and LP plaque activity. So it's kind of a complex thing. It should be a joint decision, between patient and doctor. So certainly I don't use a ton of statins myself in my practice. Just because of that, it can cause damage. Not that some people may need it. And, but most people don't. And of course, you look at your diet. But think about those things. We'll look at a little bit deeper and look at your CT calcium and see what your other risk factors are. I get more aggressive with people who have a high CT calcium. They're smokers. They have hypertension, diabetes. I get a little more aggressive.
Great question, Steve. Thank you for putting that in there. I'm going to get to Thelma's question on YouTube. Hi, is there a way of shrinking pancreatic cysts naturally? What's your thoughts on this?
Man, that's a good one. It just depends. It may be, I don't know what kind of pancreatic cyst you have. It may be an incidental finding. They were looking for something else and just happened to notice that. Most of the time I see that, or cyst on a liver or a spleen. It's usually incidental, means nothing. If you're having pancreatic dysfunction, then you need to check your pancreatic enzymes like amylase, lipase, and of course do things like don't drink alcohol, don't smoke, make sure your gut's working right, and you have the digestive enzymes like take Digest Shield, something like that, and take a look at it, because that's without knowing more about it, I'm not sure that you need to worry about it too much.
All right. Thank you, Thelma, for that question. Let's get to, I'm going to put this up from Cindy, for the people who are interested in grounding. She says, I've been grounding about 2 months. I'm also less stiff in the morning. Changes are subtle, but also have a sense of well-being in the mornings.
Wonderful.
I like that.
Wonderful. The people I've talked to that have been doing it for a while, really, they swear by it.
Yeah.
But it's not going to be something that's going to be oh, wow. The first few days you're going to, wow. I don't think, maybe for some people it would be.
Yeah.
For me, it wasn't, but I definitely am less stiff in the mornings.
Yeah.
And, seem to sleep better for the most part.
Great question there, Cindy. Thank you for great comment. I'm going to get to Angela's question here on Facebook. This has to do with long COVID symptoms in children. A friend has a 5-year-old that's immune system hasn't been the same since COVID. What protocol would you recommend for children with long COVID symptoms?
Usually I haven't seen too many. Of course, I don't see a lot of young kids, 5-year-olds, but certainly you look at diet first, and the vitamins I like are, of course, C, D, and a little bit of zinc. But also I'd probably use a little bit of NAC, and maybe even consider, I haven't used it on anybody that young yet. I have to look that up, but maybe I'll use it on all my teenage and adult patients. I use LD and low dose naltrexone. Depends on what the symptoms are, how bad it is. But certainly has thrown their immune system off, obviously. First thing I look at is gut. I know COVID can really throw your gut function off. I definitely take probiotics, and I would think about taking some of the other vitamins like I just recommended.
Just at like a prorated dose based on age?
Based on weight, age and
weight.
weight a little bit. Again, I just haven't treated any 5-year-olds for long COVID. Usually the kids are pretty resilient to it. They just don't get that sick. So I'll look into it too with some routine blood work to make sure it's nothing else, because they should be recovering pretty well by now. Now, I'm not sure how long it's been out, and by definition, long COVID is if after a month you still have symptoms.
Yeah.
Really interesting case. So it definitely deserves some blood work and a workup, and maybe trying some natural things. But the first thing I do is look at the gut.
All right.
Hope that helps.
Angela, I hope that helps. Hope they start to feel better. Let's get to Jeanne's question here on Facebook. A friend of mine had knee replacement in September, and her hemoglobin was low after surgery. She didn't do well, and doctors found out she has a torn MCL and having another knee replacement and repair in 2 weeks. She is now worried about her hemoglobin, and is there something she should take to try and build her hemoglobin up before the surgery? So this seems to be kind of a surgery prep type question. What's your thoughts on this?
So she must have had some blood loss from the first surgery, it sounded like, unless she's chronically anemic. Interesting. It's too bad she hasn't had another one. In 2 weeks, it's going to be hard to build that up. I mean, that's the only thing she could do. It depends on how low she is. I mean, she could certainly, if it's real low, get a transfusion. But she's probably not going to be that low. They wouldn't operate her on unless it's an emergent basis if she's that low on her hemoglobin. You can take iron, you can take vitamin C with the iron or right before you take the iron, but it's just going to take a little bit longer. Definitely, if she's iron deficient, she can go to the hematologist and they can give iron infusions. But it just really depends on how low that hemoglobin is. Vitamin D is always good. It's good to have a good vitamin D level before any kind of surgery. Some of my surgeon friends won't do any elective surgery unless a person's vitamin D level is above 50. They just do better. But see what the level is and what the cause of the anemia is. And because it's just going to be very hard to take an oral iron tablet with C and to get it up within 2 weeks. But I'm sure the surgeon is aware of that. They may want her to see a hematologist. Some people bank their own blood in case they need a transfusion. So they need to be prepared for that. Make sure she's not losing any blood anywhere else, like through her GI system. I assume from what I look at the question, it's from the first surgery. And she lost a lot of blood there, which she's at risk for losing more blood in the second surgery.
Interesting. Jan, we'll be thinking about your friend. That's tough. Quick turnaround. So thank you for putting that question in there. I hope that helped. Let's get to Lisa here. Can scleritis be an indication of an autoimmune disease / response? What is the best way to find out what autoimmune disease that you have? Medical doctor, and Rheumatologists have not been able to uncover it yet. The scleritis is the latest thing to happen. What's your thoughts on that?
Your sclera, the part of your eyeball is inflamed. Yeah, I mean, it could be, it could be something local. It'd be interesting to see what, the ophthalmologist says about it. But certainly, if it's bilateral, it could be an autoimmune disease or an allergy or, I'm sure if you've seen a rheumatologist, they've run all the panels on you, like for Sjogren's and lupus and those type of things. Certainly, again, I always come around this, but look at what you're eating. Make sure your gut is fine. Try the carnivore diet. Get on Digest Shield. You may even think about LDN. So if you're not coming up with any traditional answers, you're going to have to look outside the box a little bit. But I always start with the gut. So read about the carnivore diet. Read Dr. Paul Salandino's stuff about autoimmune diseases and the carnivore diet. Really interesting. You may be amazed.
Always start with the gut. That's a theme of tonight. Ladies and gentlemen, what a show. What a show. These questions were phenomenal. I'm going to put this up from D-Lynn. I believe this is a comment. You said garlic tablets for high cholesterol. I'm using oil of garlic. Oh, it's a question. Okay. Yeah. You said garlic tablets for high cholesterol. I'm using oil of garlic. Will it also help? I'll have blood work in March.
Yeah. Yeah. Mm-hmm. It should. Okay. Yeah. Garlic is such a good, it may be the number one, preventive herb out there. I'm always big on vitamin D with K, but garlic is very anti-cancer. It lowers your cholesterol. It's great anti-inflammatory. It's great for immune system. It's just fantastic. So I'm interested to see too, for high, and again, but look at least a Berkeley panel or a Cleveland Heart panel to see about your cholesterol, to see if it's really something to worry about or not. I have people all the time that are needlessly worried about their cholesterol. Anyway, it's cholesterol's not that ominous usually. Great comment.
D-Lynn, thank you for putting that in there and sparking that conversation around garlic. You have, especially like I know in office you're talking a ton about garlic, so we'll continue to talk about it more here on our YouTube channel and Facebook and Instagram pages. I'm going to put this up because I know Linda wants to see Ike, and I'm not. Are we going to be able to do it? Are we going to be able to?
Let's see if Ike will come down. Let me call him.
Is Ike going to make an appearance?
Ike, come here. Can't whistle much.
And I think, Candy, I think Katie got your question in regards to the how to do the beef liver. I'll put that up. This is a comment from Katie here. She drinks it with orange juice, and you don't taste anything but the orange juice. That's a nice little tip there, Katie.
Yeah, where'd I go? Come here.
Don't even taste the beef liver.
Good boy. Come here.
I picked this up from a carnivore account I follow on Instagram. So cool.
Look who just showed up.
Look, there he is. I'm going to put this up from Carter. Carter's here for Ike, and I knew it. Carter, I knew this. I knew this already. What I didn't know was that Carter's also on the carnivore diet.
I know.
She is a carnivore advocate. As I'm assuming, Matt, you should be a carnivore advocate here pretty soon. I'm guessing you're next up.
Matt likes beer more than he does meat. I can tell you that right now.
See, Ike,
he likes beer and the UT Vols. That's what he loves the most.
Matt likes.
He seems to like Ike a lot.
Beer in the UT Falls. That sounds a lot like me, and I'm sure a lot of other people here on the show. Montana, what's up? Montana's here for Ike as well.
He's the star of the show.
He's the star of the show. There you go, everybody. There's
he needs
Ike.
A bath. He needs a bath, but he's a happy camper.
He's in his element. He's like, I'm getting some camera time tonight. All right, guys. Guys, that is a show. Ike, thank you for hanging out with us tonight. Doc, thank you, man. I appreciate that.
Thank you, Ben.
Thank you for being with us tonight. Katie, thank you for being behind the scenes tonight. You did amazing. Thank you for being behind the camera. Guys, Carter, Montana, gosh, we had Amber in here as well. To everyone on our team, thank you so much for being with us and doing all the hard work that you do inside of our offices. We love you. Deb, thank you for being here. Goodness, thank you guys for all these wonderful questions. Steve, I love you, man. Talk to you soon. Doc, that's a show, man. What do you think?
It's a great show. I think it's good.
It's a show.
Enjoyed it.
I think
Thank
it's
you,
a show.
Ben.
I'm looking for my outro.
Get a good night's sleep.
Love you guys. Go Vols. See you guys.
Don't go away.